Welcome back to Life with the Spectrum. I'm your host, Gina Cavalli, and it truly is my goal to connect you and your family with resources and tools, organizations, foundations, people really making a difference in the world of autism. And this interview has been a couple of months in the making, and it's because he is so terribly busy. Welcome to the show, Dr. Leslie Rubin. Hi, Dr. Rubin.
Hi, Gina. Thanks for inviting me to your show.
I mean, you are a busy guy. Not only do you have the Rubin Center for Autism, how long have you had that, by the way?
You know, it's a long time because it's changed its name over the course of time. So I can say that the actual Rubin Center for Autism is about 3 or 4 years old, the name. It used to be Developmental Pediatric Specialists before that.
What made you get into the world of autism, Dr. Rubin? Does it affect your family? Do you have family members with the diagnoses?
You know, that's actually a good question. When I was growing up, I had 2 cousins with developmental disabilities, and at that time it was not classic autism. One of them had cerebral palsy and another one had some intellectual disabilities, but I grew up with them as cousins, and just kind of...
It morphed itself.
That's who they were, That's who they were. I guess I had that kind of connection. And when I got involved in clinical pediatrics, my interests were in neurology. So I got involved with neurology because it had to do with the brain. But I found I was much more interested in the more complex elements that not only were manifested and diagnosable as a neurological disorder, but how they affected an individual's function, how that individual was able to live a life, to learn as a young child, to interact with other people, to become more successful in life, etc. So it became my interest became much more around optimizing a person's function. And that's sort of medical as well as learning and cognitive and social.
Now, how many patients do you currently have at the Rubin Center for Autism? Because I know you also do another big service to our community, and that's through the Break the Cycle program, your foundation, right? But how many patients do you currently have at your center?
A lot. I can't count.
Too many,
yeah,
right?
Many.
Because then in addition to that, you're teaching at CHOA, you're teaching at Emory, you're teaching at the Marcus Institute. You're helping young physicians just starting their journey into the medical field, right?
Well, in Morehouse School of Medicine, I'm not affiliated with the Marcus Center, but I used to be. But with Morehouse School of Medicine and Emory, yes.
And what are you exactly teaching these young medical professionals that are just getting started?
How to approach the diagnosis and management of children with developmental disabilities of all kinds and their families, because not only do I see children with autism, but I do see children with other disabilities and do have a clinic for children with cerebral palsy as well. So that sort of expands my clinical scope, actually.
You are a busy man, too, because you're out speaking in other parts of the world. You were just in Mexico, weren't you?
Unfortunately, not the beaches, but...
What were you talking about to the individuals you met with down there?
Yeah, it was the Mexican Academy of Cerebral Palsy and Developmental Medicine, and I spoke about autism as one module. And I also spoke about health disparities and developmental disabilities as another model, which was, in fact, I was very flattered because they had modeled their conference on my Break the Cycle of health disparities. And in fact, their conference was called Breaking the Cycle of Health Disparities, in Spanish, of course.
Which I don't know a lot of Spanish. So listen, Dr. Rubin, I want to talk more about this Break the Cycle program when we get back. Stay with me.
Hi, I'm Lear Gilmars. Thanks to our friends at
Welcome back to Life with the Spectrum. I'm your host, Gina Cavalli. With me today, Dr. Leslie Rubin, the hardest working man in medicine here in Atlanta, teaching, running your Rubin Center for Autism, and then branching in to this Break the Cycle program, your personal mission and foundation to help with disparities amongst communities, right? The socioeconomic, it can be very different when children get that autism diagnosis, or any diagnosis for that matter, compared to another child. Do you care to share a little bit more about your foundation?
Sure. It's so interesting because I'm originally from South Africa. So in South Africa, there was major disparities at the time I was growing up, and just persecution and discrimination and oppression. So I escaped and I came to the United States where everybody's free, right? And everybody's equal. So I lived in Cleveland, Ohio for 4 years, and then Boston, Massachusetts for 14 years. And when I came to Atlanta, one of the things I did was start a clinic for children with cerebral palsy. And after a couple of years, we surveyed the children who'd come to the clinic, and what I discovered was that so many of the children had been born prematurely to mothers who had been young and who had taken substances, tobacco, alcohol, and those kinds of drugs. And the children with cerebral palsy, 50% were living with single mothers, 20% with grandmothers, 10% in foster care, and only 20% in two families. And I realized that there's a relationship between poverty and disabilities, that being poor sets you up for adverse health outcomes. For example, in the situation I'm describing, where these young people who didn't have much of a future, didn't have good education, landed up with a limited future, would take drugs to feel better, have sex to feel better, and then would get pregnant. And these babies were exposed to substances, and then they would be born with difficulties, and that was the cycle. So I conceptualized that cycle of what I call disadvantage, which is social and economic, and disability, which in that case was cerebral palsy. But I've since expanded the notion to other environmental factors like air pollution. So people who live in poorer areas are much more likely to be exposed to pollution from traffic or other factories that are set up nearby. And they're more likely to be exposed to heat when we have heat waves, because they live in areas where there's less greenery, and the asphalt and the buildings reflect the heat. So the temperature in these areas can be like 7 to 10 degrees higher than it will be in suburban neighborhoods. So they can get dehydration and serious illnesses. I'm just mentioning a couple of these issues.
Now, would you also say that because of being in different areas socioeconomically, that people are not then given the proper diagnosis as soon as maybe other people in other areas, and then that, of course, leads to less, preventative preventative measures like early intervention and things like that?
100% correct. That we know that these children who grow up in poorer areas have less access to quality health care, and their health care access is limited, and so they have delays in diagnosis. And in fact, that's why we started the autism clinic at the Hugh Spalding Children's Hospital to serve this population. And we also started a program called Break the Cycle of Autism Disparities that is ongoing and part of the bigger picture of Break the Cycle of Health Disparities.
I bet you have a wait list of people wanting to get in to see you and getting that diagnosis and then figuring out where they go next. And I know you probably have a great team of people that go in and share that with them, like, get them on the Babies Can't Wait here in Georgia. Do you find that these families are coming to you not just with autism, but a variety of disabilities then?
Yes. Autism is one diagnosis as part of a bigger picture. But you were alluding to access to services as well. The good news is that there is Medicaid, and there's additional services called additional policies of children's health protection, but the access to healthcare is limited because not every provider accepts Medicaid. The reason being that Medicaid pays less for a visit than you would get from a third-party insurance like Blue Cross Blue Shield or United Healthcare, so that it's providers to keep their sort of the healthcare delivery businesses going would be reluctant to take Medicaid because the reimbursement would not be worth the effort and the work they put into it. So the access to health care services from poor people is there, but it is limited in quality. So people for my clinic downtown can wait months, and it's unconscionable.
Oh, that's got to break your heart.
Absolutely unconscionable.
Don't you hate it that there's so many of these erroneous policies out there that prevent people from getting the help that they need?
I think if we can get more healthcare professionals, if we can get funding to support training of healthcare professionals in this particular field, we will be able to reach many more people. And if we can change some of the reimbursement policies and provide better quality of health insurance to families who are poor and cannot afford the third-party insurance, then I think we would do a better job.
When we get back with Dr. Rubin, we're going to find out a little bit more about what's on the horizon for the Break the Cycle program coming up. Welcome back to Life with the Spectrum. I'm your host, Gina Cavalli. With me today, a very busy man on all fronts, Dr. Leslie Rubin. Thank you so much for carving out a little bit of time for the show today. Dr. Rubin, I know that you have a big in-person, the Break the Cycle program has a big conference coming up in just a few days, April,
Exactly,
17th and 18th,
exactly.
right?
The Break the Cycle is, now, since I started in 2004, now we're in our 18th year, and every year we recruit students from universities around the country and actually around the world. We've had a number from Latin America and some from Africa who participate by submitting applications to do projects with us. And these projects have to be address the health disparities of children and have to have some element of breaking the cycle. So every year we recruit about 10 students to do these projects, and we work with them over the course of a semester, and then we train them to come to Atlanta to present their projects, which will be on Monday, April 17th. And then after that, we have them write up their papers for publications into a journal, and then it also is published in a book. And if you like, I can show you the covers of the book in a moment, but I also want to tell you that each year we have a theme, and this year our theme is addressing the healthcare disparities among indigenous children from Native American communities around the country.
Oh, I didn't even think about that, being on the reservation, having less access to so many different things. That's a real deal.
It is. So on Tuesday the 18th, we will be having a symposium on health disparities among indigenous children. Now this conference and symposium conference and day 1, April 17, and symposium day 2, April 18, are going to not only be in person at Emory University Hatchery, but also be accessible virtually, remotely. So if anybody wants to participate, they have to go to our website, breakthecycleprogram.org, and register. So if they register, they will get a link, and the link will enable them to participate virtually and get the benefit of an incredible program that we're going to have. I'm excited about the program.
I'm excited about this program too. I would have never even thought about that. But you're right. Disparities come in all shapes, sizes, colors, races, religions, all across our country and really all across our world, too. There's a reason, Dr. Rubin, you were nominated by your peers for Atlanta's Magazine Top of 2022, wasn't it? And it's because of all your hard work.
I guess so.
Yeah, I guess a humble man, too, at that. I love it. Dr. Rubin, stay with me. We're going to find out how people can find you and find, again, about the Break the Cycle program coming up.
I'm Lyra Gillenwaters. Thanks for checking out this episode of Life with the Spectrum. If you subscribe to the channel, you'll always see the newest episodes when they come out.
Welcome back to Life with the Spectrum. I'm your host, Gina Cavalli. With me again today, Dr. Leslie Rubin, who owns and runs the Rubin Center for Autism, teaches at Emory, Children's Healthcare of Atlanta, Morehouse School of Medicine, and you've got a great symposium and conference coming up with Break the Cycle, the program, the foundation that you yourself started. So how can people find the center, the program, the foundation, and where are you on social media, Dr. Rubin?
I have a website. I have a website. So the website for my center is called the Rubin Center for Autism.org.
Okay.
The website for my nonprofit is called breakthecycleprogram.org.
Okay.
And, I've been very negligent about social media. You have to work very hard to keep up with social media, and I don't have time to keep up with social media.
You should hire somebody for that. What's the biggest takeaway I think you'd want? I mean, I have viewers north, south, east, and west of the city and abroad. What's the biggest takeaway you'd like people to know about breaking the cycle, what they can do, boots on the ground, where they're at in their community or their country, for people outside of the country in Spain watching today? What can people do?
Wow, that's a big question. I'll tell you, when I first started the program in 2004, I thought, poverty was the big driver of these disparities, which it is. And I said to myself, if President Johnson could declare war against poverty and not yet win, what's Leslie Rubin going to do to change things? And I realized that each individual of us, just has to do very little. We just have to recognize somebody else who has a greater need than we have and see in what way can we help a person who has a greater need than us in any way. It doesn't have to be declaring war against poverty. It doesn't have to be starting a Break the Cycle program. It just has to be a small gesture, a charity, a donation to charity, a good deed, giving somebody a meal, just finding somebody who has a greater need than ourselves. And giving it.
Learning how to be accepting. Acceptance is key in the world of disabilities, and being autistic means different, not less. Some of the most brilliant minds still today are on the spectrum, and what you do, not only, giving that diagnosis and helping create a master plan for families, and then going in and helping to teach the young professionals just starting their medical journey. Dr. Rubin, I know you probably get this all the time, but thank you.
Now, Gina, I just want to re-emphasize what you said, which is accepting every human being for what he or she is, and respecting each other, which I think is the foundation for harmony and peace and promoting optimal health for everybody.
Well, I just dig you, Dr. Rubin. I wish you could meet Lyric. I wish he was here with me today so he could say hi. You would just love him. 10 years old and just the smartest kid on the block. Different, but not less, which is why the whole inspiration behind this show is because of him.
So, that's so nice.
Yeah. Thank you so much for being with me here with me today, Dr. Rubin. I appreciate you and all that you do.
Thank you, Gina, for inviting me. It's been a pleasure.
Folks like Dr. Rubin are making a difference one child at a time, one family at a time. And if you need his services, reach out to him, please. The Rubin Center for Autism.org. If you want to learn more about that Break the Cycle program, they have a symposium coming up the 17th and 18th. You can do it IRL or virtually. Go to breakthecycleprogram.org. Thank you so much for checking in to Life with the Spectrum. I appreciate it. Like, comment, share, subscribe. If I need to be reaching out to somebody in particular, please let me know. Comment below. Send me a DM. I'd love to get them on the show. As we live this crazy journey called life, we'll see you next time on Life with the Spectrum. See ya.
Bye.